Honorable Magahaga, Governor Lulian Guerrero, as well as their Segunda Magalahan Guam, Lieutenant Governor Josh Tenorio.
Half a day. Since last night, we have an additional 8 cases of COVID-19. This brings our total to 77 cases with 3 deaths and 9 recoveries. While I do not want these numbers to dishearten you, times are tough and we have harder days ahead of us. We have taken and will continue to take clear and decisive steps to protect ourselves, but we must also protect the humanity and compassion which has been the hallmark of our people for centuries. I know my decision to allow the restricted housing of sailors who have tested negative for COVID-19 off base has left a few of you uneasy. This decision was not made in haste, and I, in partnership with the military, Guam Hotel and Restaurant Association, and public health officials, are taking every precaution necessary. I must reiterate that only sailors who have tested negative for COVID-19 will be allowed to stay in the vacant Guam Hotel rooms under restricted access. Furthermore, not every sailor who tests negative will be housed off base. The military will be providing security to ensure these sailors do not leave the perimeter. And these are the conditions both sides have agreed to. As has been said before, no good partnership leaves either party in a deficit. For this reason, I have submitted a request to the Department of Defense for critical supplies, including masks, gown, eye gear, and ventilators. These are supplies our frontliners need to keep us safe, and I am confident that DoD leadership in Guam and in the nation's capital will work hard to fulfill our request. This pandemic shows once again our strength when we come together. I am always amazed by the resiliency of Guam's people. We survived Typhoon Pamela, Typhoon Omar, Chataan, Pongsanwa, major earthquakes and economic recessions, 9/11, nuclear missile threats. We've survived bird flu, SARS, and HLNL, and we will survive COVID-19. Our administration has taken drastic but necessary measures to battle this virus, and we know that even greater measures might be necessary. Though some argued that the mandatory quarantine of travelers from the Philippines was unnecessary, 3 individuals tested positive for COVID-19 and are now isolated. This action prevented those individuals from spreading COVID-19 to their friends and families. It worked, and we should be thankful for every person who has helped in this process. I am also happy to report that 124 people previously in quarantine are now safely at home with their families. I thank them for their sacrifice and patience. It wasn't easy, but what you did helped to protect the people of Guam. But please remember, you have to stay home and do the measures that we have always been talking about. All of us are human, and nothing about this has been perfect, but we know to stumble is not to fall. The very core of our people is to help one another, to share our strengths and our burdens through good times and bad. And we did not let fear change who we are. Our COVID hero today is Shalimar Yosingo Edera. Last week, she baked fresh macaroons, mocha cake, banana bread, my favorite, for our frontliners at the GMH emergency room. I know her treats uplifted the spirits of the hardworking personnel at GMH and gave them an extra push as they continue to combat the spread of COVID-19. Thank you, Shalimar, for your kind gesture and for being a COVID hero. I would like to ask Admiral Noni now to also make some comments.
Good afternoon, Governor. Thank you for having me here again. I first want to extend my sincere thanks to the government of Guam and the Guam Hotel and Restaurant Association for your continued collaboration and developing solutions for getting the crew of Theodore Roosevelt healthy. I also want to express my appreciation for all the people who are on the front lines of this island's fight against COVID-19. Clearly, I want to highlight key enablers such as our healthcare professionals and emergency medical services personnel, but also we should all consider saying thanks to the grocery store and gas station employees, the commissary and NEX employees, as well as your local military team that are keeping our economy running so we can get needed supplies and perform essential services. Your sustained efforts are keeping us in the fight against COVID-19 while allowing your Navy and your joint force to operate. Thank you for everything you do. Next, a public service announcement. I would like to put out a request for all of our extended military family on Guam. Naval Base Guam and Anderson Air Force Base announced base access changes about 2 weeks ago due to the COVID-19 coming to our island. These measures are designed to keep everyone safe and allow the bases to keep operating smoothly. They help eliminate excess congestion resulting from vehicle turnarounds at the gates when people try to come on the bases at the wrong time. These measures will help prevent traffic jams, increase safety, and minimize the stress and fear and frustration that we all feel. Most importantly, these measures enable us to maintain social distancing in base facilities, which is the key means of preventing the spread of COVID-19. Please understand and comply with the base access guidance announced by our 2 bases. Now, over the next 12 to 24 hours, we plan to move the first group of COVID-19 negative asymptomatic TR sailors to approved commercial lodging for quarantine in accordance with the governor's executive order and CDC guidelines. Sailors will only be permitted to depart the base following a negative COVID-19 test result, and they must remain in quarantine in their assigned rooms for the duration of the mandatory 14-day quarantine by lawful order of their chain of command and in full support of the governor's executive order. Military leadership will be present throughout lodging to ensure sailors adhere to quarantine protocols and remain in their rooms. This will be entirely a military-run operation with no direct contact between the TR sailors and their hotel staffs. These sailors will be transported by military vehicles to lodging and will not come in contact with the local community during transportation or their stay in our hotels. We continue to test TR sailors in order to prevent the spread of COVID-19 to ensure the health and well-being of the crew and maintain our mission readiness. Your military and the government of Guam have been working diligently to help TR leadership coordinate COVID-19 mitigation planning and to ensure the safety of all of our sailors and the residents of Guam. By getting more sailors off the ship, we are able to more effectively implement social distancing on board for the remaining crew members required to maintain the ship. Theodore Roosevelt Strike Group, Joint Region Marianas, and your Navy are extremely thankful for the overwhelming support from the people of Guam in our fight against COVID-19. Thank you.
Thank you, Admiral. I'd like to ask Linda now to give us the latest update on our COVID status.
Thank you, Governor. As of March 12, 2020 to April 1st, 2020, we had a total of 479 tests. And of that amount, 402 were negative and 77 were positive. And of the 77 positive cases, 71 were local cases and 6 from the U.S. Naval Hospital. And that was because they had tests done through the DoD reference lab in San Diego. In regards to our demographic breakdown of our COVID positive individuals, 28 are from the northern region, 30 are from central, 13 are from the southern, 2 are homeless, and 4 are pending determination. The age breakdown for the following are as follows. There are still no children 0 to 19 years of age with any COVID cases. From the age group 20 to 29 years, we have 5. In the age group 30 to 39 years, 10. 40 to 49 years of age, 14. 50 to 59 years of age, 13. 60 to 69 years, 23 cases. 70 to 79 years, 7. 80 to 89, 4. 90 and above, 1. Thus totaling 77. In regards to the gender breakdown, we have 40 that are males and 37 females. In regards to the medical status, the stable patients that we have right now, there are 31, and those that are hospitalized, 31. The breakdown of those who are hospitalized, we have 21 in patient care units, 2 from the ICU, and 8 from SNF or SNU. 12 have recovered, and 3 have died. That's a total of 77. In regards to the location of these COVID cases that are in isolation, we have 28 currently in the home isolation, 3 at the isolation site, 8 at SNU, 21 at GMHA, 2 at the ICU unit, 12 have fully recovered, and as I mentioned earlier, 3 have died. For the travel history of these patients, we have 1 from Japan, 10 from the Philippines, 3 from the US, 1 from Singapore, 2 from Dubai, and 60 with no travel. That's 77 individuals.
Thank you, Linda. Now we're open for questions.
Marvick from the Pacific Island Times.
Hello. Can you hear me?
Yes. Yes,
Okay.
Marvin.
Oh, yeah. My question is for Admiral Menoni.
Yes.
Okay. Hello, sir. Hi. My name is Marvick from Pacific Island Times. Well, in the middle of all this COVID crisis, North Korea has been launching a series of missile tests. And with Roosevelt now seemingly incapacitated and the Navy's attention is focused on the sailors' health, what guarantee do we have that Guam is secure from any possible sneak attack?
So first, I need to clarify, Theodore Roosevelt is not incapacitated. That ship could go to sea tomorrow to perform security missions if required to. I'm in constant contact with not only the TR Strike Group commander, but also the fleet commander, and I'm assured that the ship could get underway if it was required to. The reason it's in port is we have to put the health and welfare of our sailors at the forefront and take care of them. We have a moral obligation to do that, so that's why we have them here. With respect to your question about North Korea, nothing has changed from before COVID-19 to today. Your military is still on watch around the world. It's ready to defend not only the United States, but Guam and the CNMI. And anytime there's any issues that we see around the world, I get in contact with the governor and her staff to make sure that they're advised of what's happening.
Okay. Can I ask one more question? Okay,
Yes,
so
Marvin.
Navy officials said that more than 1,000 sailors have already been brought ashore since yesterday. Where exactly are they now? Are they now already in the hotels? And number 2, the 20 sailors who are originally from Guam, are they allowed to join their families?
So with respect to the 1,000 sailors, they're all housed on Naval Base Guam, whether it's in isolation quarters or quarantine spaces. With regards to the 20 sailors, they're part of the crew, so they are subject to the same lawful orders and governor's executive orders, and they will comply with the social distancing rules and the quarantine. So the answer to that is no at this time.
Okay, thank you.
You're welcome.
Pacific News Center, Kevin Kerrigan.
Yes, good afternoon, Governor.
Hi, Kevin.
This question is for Linda DeNorsi, I think. It has to do with the quarantine ending for the first group of passengers who arrived from Manila a couple of weeks ago. We understand that 3 from that group have tested positive.
Yeah.
Court order allowing their quarantine to be extended and the quarantine of anyone they may have come in contact with to be extended as well. So what my question is, in total, as a result of this court order and the ending of the 2-week quarantine for those Manila passengers, in total, how many of those passengers arriving from Manila will have their quarantine extended and for how long?
Yes, right now we're counting at about 4 of them. 3 are positive, and we do have 1 case that was in close contact with the March 19 case, and that obviously is going to have to extend. In terms of how long the extension will be, with the 3 that are in isolation area, it'll be contingent upon how soon their symptoms dissipate. So when they are free from symptoms, then we count 3 days or 72 hours from the date that they are with no symptoms. And then once they're done with that, you have to also include 7 days from the date of the first date of the symptom. So for example, if day 1, they're with no symptom, but day 2, they have a symptom, and so that symptom you have to have 3 days after day 2. So that would take you to day 3, 4, and 5. So by day 5, you should have no symptom at all. But in order for them to be cleared, they would still have to have at least 7 days from that day 2 when they started. So if you start from day 2, count 7 days down. So that would be going to day 9. And so day 9, they will be released. It will be continuing again upon every case that we have. So it also depends if they're free from symptom at maybe day 3 and then they're okay, then symptoms may reappear. It all is based upon that criteria that I just mentioned, the US CDC criteria, where 3 days first without symptoms and 7 days free of symptoms from the first day of that symptom, which I gave you the example.
But to be clear, 4 are being held over in quarantine as a result of the court order. Is that correct?
Right now, they're no longer in quarantine. We already moved 3 of them to the isolation facility. So they're no longer in the quarantine area. So they're right now at the isolation area. They just moved today. So we have 3 of them.
3 in isolation, and
Yes.
quarantine is not being extended for any of these Manila passengers?
Yes, they were from Manila. Yes, that is correct. And then we have the other 2. So one of them moved from one of the quarantine site, and then 2 of them moved from the other quarantine site, and they're all 3 of them are in the isolation facility as of today.
Right, but again, for clarification, as a result of the court order, you are not extending quarantine for anyone. Is that correct?
No, we're only extending quarantine for these these travelers. If the others, they met their 14-day quarantine and they have no other symptom, they're cleared. They're already released. In fact, we released them already and they're gone. So we, as the governor had mentioned, 124 passengers are now out of quarantine as of this morning. They completed their 14-day quarantine.
Thank you, Kevin. Wayne Chargaloff, Mariana's Business Journal.
Hello, my question is for the governor. I was wondering, when will we start to see, get updates as far as numbers for unemployment? We've been getting like kind of numbers here and there from various sources, but would you be able to give us a timeline of when you expect to have solid unemployment numbers for the island right now?
Oh, unemployment numbers, again, I don't have a date where we could get all of those, but we are already starting to work with the employers to get us those numbers.
Right.
So I don't have a date, and I don't have the numbers that's already been employed. We can get those if Dave has those numbers already. They go through the Department of Labor.
Right. Okay. Thank you.
Wayne, do you have a follow-up?
Yes. When will, do you have any idea as far as when Tax will be able to start verifying tax returns and then convey that information to the IRS? Like, I know the tax date has been moved to July 15, correct? So is that system already in place for how they're going to convey that information to the IRS?
Well, it's the same system and process that they're doing. It's just delayed from April to July. Yeah.
Right. So there are no anticipated delays for conveying that info.
Are you thinking about the rebate? Are you referring to the rebate benefit, Wayne?
No. Just like the regular tax return. Just if there have been any delays due to changes to Revenue Tax operations.
Yeah, it's the same process. You file it, they'll process it, and you know, they will put you in the same time frame for tax returns like we are currently doing. So nothing's really changed other than you are now given the opportunity or the extension of from April 15 to now July 15 to pay it.
Thank you, Wayne. KUAM, Nestor Locanto.
Yes, thank you. Good afternoon, Governor.
Hi, Mr.
First question is for you. I was wondering if you could give us an update on the cash flow. I know it's GovGuam payday tomorrow, but obviously the big revenues that we typically expect in April are not going to be coming in. Can you give us an idea of where the government is situated in terms of its finances?
Okay, so we are making payday. There's no delay in the paychecks. We are also able to provide for the budget funding for the operations of all of our government services, public health, health, education, public safety, all the judiciary, the legislature, the whole government. So we are able to still make those expenses and pay for those expenses.
Thank you. My next question is for the Admiral. If you.
Hi, Nestor.
Good afternoon, Admiral. Good to see you. So there was a press briefing this morning at the Pentagon, and the Navy Surgeon General, Rear Admiral Bruce Gillingham, had mentioned that the Naval Hospital now has diagnostic COVID-19 capabilities. I wonder if you could elaborate on that.
So we're close. So I don't want to contradict Admiral Gillingham, who I consider one of my mentors and friends. However, we typically are working our diagnostic capability for COVID-19 back through the research center in San Diego. We are currently calibrating and setting up AB 7500 system, which is a lot of medical jargon for a COVID-19 testing machine. We anticipate that within the next 7 days, roughly, we'll be able to conduct tests at Naval Hospital Guam.
And will the local medical facilities be able to also send their samples for testing?
So Nestor, with all of our capabilities, we're going to provide a backstop to government of Guam's capabilities. And I've assured the governor, and has been assured to me by Admiral Aquilino, the Pacific Fleet Commander, if the governor needs something, I'm to help provide that service, whether it's some PPE, whether it's tests. We'll do what we can given the constraints that we're all under across the country right now.
Thank you, Nestor. Pacific Daily News, Jasmine.
Hafide, thanks, Gov, for your time. I just had a question again about the sailors on the Roosevelt. Captain Crozier wrote that in his letter, some sailors tested negative and then they tested positive. How do we know that the sailors that will be sent to the hotels who are negative now won't later test positive?
So I guess that's the $64 million question. And as I'm not a medical professional, but I'll tell you, no medical test is ever perfect. So tests will be conducted on these sailors. No sailor is going to get off that base without a negative test. And then no sailor is going to get off that base without a negative test and also being asymptomatic for any influenza-like symptoms. So that's, I think, in excess of what CDC guidelines are at this point. But I cannot predict the future like you just asked me to.
So can I just follow up? Just like in our quarantine, if I know that one of the conditions that we've agreed is that the Navy will provide medical staff that's going to be checking these sailors on a daily basis, just like we did during our quarantine, where we had our public health nurses check these people that are quarantined twice a day. And this is how we found out about these 3 individuals that got positive. So it's the same process that's going to happen there. And once they find out that they are positive, I know that they will then be sent to Naval Hospital for the appropriate measures and the appropriate treatment, isolation, and so forth. So again, I want to assure our people that these individuals that do become positive do not impact our healthcare system at all. The Navy has their own military healthcare system, and they would be treated in their healthcare facility.
Jasmine, you have one more follow-up.
Okay, thank you. So I know that we've been assured that this is a military operation and military will sort of ensure the sailors stay in their rooms. But what can local law enforcement, if anything, do if sailors don't abide by directives to quarantine and isolate as they've been told?
So our local laws are the same that we had put into our quarantine. They will abide by our local laws, and they do have to comply with our conditions. Otherwise, they would probably be taken back to the military base, but Admiral Mamoni can maybe elaborate on that.
So that's a great question. Thank you for that. The Strike Group Commander, Admiral Stuart Baker, has issued a direct order to each one of these sailors that they'll personally have in their hands that they're to stay in quarantine. Any sailor who violates that lawful order will be subject to the Uniform Code of Military Justice. I have to assure the people of Guam and our local military community, I take this deadly seriously. There is nobody that's going to violate an order on my watch and get away with it.
Thank you, Jasmine. Guam Daily Post. Nick Delgado.
Nick Delgado here. Hi, Governor.
Hi, Nick.
So I know in the past week there was a lot of discussion about flattening the curve and trying to prevent us from hitting our breaking point in terms of hospital beds and equipment. But with the trajectory we're seeing now in the number of cases, what point do you think that we'll be able to sustain ourselves with the equipment we have on hand, and when we'll be out of the woods, as you say? Or will you extend that public health emergency?
Right. So, Nick, that's a really good, I think, question. My medical advisor people are tracking the cases, and they're also looking at the predicted trajectory, and they're also looking at how is this trajectory impacted by the measures that we have implemented 2 weeks ago, 3 weeks ago. And so we are going to give a more detailed presentation tomorrow as they are getting their numbers up to date. But given that, because of this trajectory, we are preparing our hospital resources, our medical resources to be able to meet the challenges. And that's why in previous press conferences, we have told you of what we are doing with the hospital to decompress it so we can make available hospital beds and available spaces for the predicted surge. I just want to say that that's a predicted situation, and we are working everything we can with our measures to do flatten the curve before we even get to those predicted numbers. And they'll give you a much detailed presentation tomorrow, but just be informed that we are preparing, and we are putting in various options that we will be doing to make sure that there's enough bed capacity, to make sure there's enough ventilators, to make sure there's enough PPEs, to make sure there's enough mask gowns and so forth, so that we can adequately address the respiratory distress situations that this COVID virus leads into.
Like no decision yet on the extension of the public health emergency. I guess we'll wait to see when we get those numbers. My second question, Of course, there are many people concerned that as jobs are lost, hours are cut, desperation is setting in, and it's leading to what people believe is an increase in crime. Does the administration have a plan to address that particular issue? Maybe more officers out there, or
Yes.
what is the plan?
Yes, we are. And we have, done an inventory of our law enforcement resources here, Nick. We've pulled in the Chief Justice from the courts, and he is giving us marshals. We've pulled in customs, and they're giving us customs officers. We're using we're using airport police, we're using port authority, we're using National Guard. We have the capacity to, and we have deployed mission ready National Guard resources. So we want to make sure that we have a big presence in the community with our patrol officers. So we are supporting them with other law enforcement officers in the other various agencies. National Guard is going to be a big help.
Thank you, Nick. Reuters, Steve Gorman.
Hi, can you hear me okay?
Yes, Steve.
So this is actually a question I wanted to put to the Admiral if he has a moment.
Sure.
So of the, how many more sailors are going to be taken off the ship? You said there's a first group of 1,000 who have tested negative so far. Are there more that are going to be taken off the ship? And how many have tested positive so far?
So Steve, I'm not going to get into numbers at this time in terms of positives and negatives with respect to any naval unit. There have been 1,000 sailors, though, that have been taken off the ship. A certain percentage of those are in isolation because they have tested positive or they displayed influenza-like symptoms, and they're in the process of being tested. Another percentage of that is in quarantine locally on Naval Base Guam. So none have come outside the fence line of Naval Base Guam at this time.
Okay, and can I follow up? There's been discussion of whether there would be any consequences for the skipper or the captain of this aircraft carrier for going public in the way that he did to draw attention to the plight of his crew on that ship. And I wonder if you could address that in any way, whether he's in any kind of peril of some kind of discipline or action or something like that.
So, I'm not going to address that in terms of process or anything like that. And I'm not aware of any of those discussions. That's not my role. What I will tell you as a commander and a leader in the United States military, all of us have a moral obligation to, one, ensure that we're mission ready when the bell rings or the nation calls. And then second, equally important, and the most important part of any weapon system is the health and welfare of our sailors. And it really is our military personnel, so it's not just sailors. We have a moral obligation as commanders to look after our folks because they're the biggest part of any effective weapon system.
He did the right thing and doing the right thing to do.
Yeah, and I'm not going to get into a discussion over right or wrong on this because it's not my role.
Okay. Well, thanks for taking my.
Hi, I've got a question for the Admiral. It's Lucy from the Wall Street Journal. I'm just wondering if you can tell me kind of a bit of a timeline on how you chose the 1,000 sailors that have come off the ship, whether they're tested on ship or tested at the base, and whether those tests then go to San Diego and how long it takes for you to kind of get results back.
Okay, so there's a lot to unpack in that question. I'll do my best for you. The first part of that question, I believe, is how we decided on and what we have to do is ensure the mission readiness of that ship and that crew. So clearly anybody who was positive for COVID-19, anybody who was having medical issues had to come off that ship. treated, isolated, and back to the rest of the group, and try and get folks off that shipping date effectively. Remember, this is not our increasing populated birthing state. Then allow them time to clean the ship. That's kind of how we look about flow and a process. Get people off the ship, test them, make sure that they are negative, positive isolation, negative quarantine. We need to do health and welfare checkups. That says we need to go along the way, clean the ship, get people back on the ship.
Follow up. And those tests are going to San Diego?
At this time, all tests that are done in the hospital back to San Diego. There's a limited aircraft carrier.
And how long does it take? Do they have to be sent to San Diego, like flown to San Diego, or can they be like, I don't know, sent by a computer?
Can you repeat the question?
Oh, sorry, it's not a really bad line. Like flown to San Diego, or can you send them via some sort of technology? I mean, is it a physical thing that has to be sent?
I'm having a hard time understanding the question. I'll try and answer what I think I heard.
Okay, sorry about my phone line.
Okay, try one more time.
I'm wondering whether or not the tests, when they're sent to San Diego, if it's a physical test that has to be sort of flown in like a box to San Diego, or whether it's some sort of something that you send by computer and then they can look at the results and tell you whether or not someone is positive.
So, and not a medical professional here, but the Naval Hospital tests, when their tests are being confirmed or not confirmed in San Diego, how they get back there, I believe it's an air bridge, but I don't know for sure, and we can get back to you on.
Okay, that's fine. Thank you so much.
Do you have any closing thoughts?
Just to say, as we move along down this struggle to eradicate coronavirus, please know that things are very dynamic, they're very fluid, things change. Decisions that are made may be different the next day based on what our situational awareness is, based on what we are seeing in test results, based on what we're seeing in the acuity of the patient at the hospital. But I just want to make sure that the people of Guam understand that we are working everything to be prepared for any anticipated surges, and that the people of Guam are protected with the measures that we are doing, and we are making sure that we provide the necessary equipment, supplies, and so forth, so we can move forward in this battle. But our win cannot be without the help of you. You are our soldiers in this great battle, and I do appreciate your understanding, your patience, your commitment, and your support. Thank you again, and please be safe, stay home, don't spread the virus, and do social distancing. Thank you, and Sidus Masi.
Thank you for joining us. See you all tomorrow at 1 p.m.